of the show, our three questions that
with Sugar Fix in Chicago with Dr. Jessica Emery. So thank you so much for jumping on.
I mean, I'm still gonna work on it, but
then right away, as soon as that first thing comes out, they sign up for it.
Welcome to Dental Tech Chat. I'm your host, Allie, and I have a very special guest to introduce you to today, Dr. Melissa Seibert. She is the creator and host of the Dental Digest podcast and now the CEO of the Dental Digest Institute. She is also a dentist proudly practicing in the United States Air Force. As a dentist in the Air Force, she has multiple additional duties such as infection control officer, radiology officer, safety officer, and continuing education officer. She is also passionate about fitness and is her unit's physical fitness leader. As an athlete, she has ran over 5 marathons and 4 half marathons. She's received her Doctorate of Medicine in Dentistry at the University of Louisville. Dr. Seibert is a graduate of the United States Air Force Advanced Education in General Dentistry. She is well trained in disciplines and procedures such as IV sedation, complex third molar exodontia, limited orthodontia, biomimetic dentistry, periodontal surgery such as crown lengthening, flap osseosis, guided tissue restoration, and aesthetic dentistry. Dr. Seibert graduated Alaman's Biomimetic membership course in March of 2021. She now serves as a board member for the Academy of the Biomimetic Dentistry. She was also selected for the Air Force's highly competitive 2-year AEGD, which she will be beginning in the summer of 2021. Now help me welcome, and it is my pleasure to bring you to the interview with Dr. Melissa Seibert.
Hello and welcome to Dental Tech Chat. I'm your host, Allie, and tonight I have a very special guest, Dr. Melissa Seibert, here with me today. And I'm so glad to be interviewing you. So welcome to Dental Tech Chat. Tell me what you've been up to and how's everything been going?
Yeah. Hey, my name is Dr. Melissa Seibert. So we were just talking podcasts earlier, talking shop. So I am the creator and host of the Dental Digest podcast, which our niche is just devoted to evidence-based dentistry and really keeping dentists on the forefront of dental education. I am a dentist in the Air Force practicing active duty. So that's who I am.
Well, thank you for the recap. I was just about to really say hats off to you because I know you do so much for this community and you give so much value and so much credibility. You're kind of like the Wonder Woman, I feel like, of dentistry in your own special way. Like you honestly go above and beyond to share all this knowledge and like keep giving it out. And it's just so great that you've created this wonderful community on your podcast, The Dental Digest. So thank you for being here. I'm so glad to have you.
That is so funny. I don't know if you knew this, like maybe it was some subliminal messaging because you've seen my Instagram, but I am obsessed with Wonder Woman. Like that was my nickname in undergrad, and like that just meant so much to me, and I'm obsessed. But I will say the second movie was not very good. Did you see it, by the way?
Yes, I did.
Disappointing.
Disappointing. Yeah, the first one really just like was like amazing. I mean, are you kidding me? That Gal, right?
Gal Gadot, yes.
Yeah, Gal Gadot. She's still amazing. She definitely specifies the role, but you are her in dentistry. I am telling you.
That is so kind. That is the kindest thing ever.
You're so welcome. You deserve it because honestly, just like you're just like the girl who comes in, swoops in, you want to learn it all and you're never going to stop. Like you're always going to want to save the dentistry day. And that's how I feel you are. Like you want to give dentists the right education, the right tools to really make their best dentistry happen. So way to go for you. Like, honestly, hats off to you.
That is so kind. Thank you. Thank you.
You're so welcome. So this kind of brings me to this really fun question before we jump into our tech talk really quick. Have you always just like a first thing off is for me is like, I know how much you're into dentistry, but did you always growing up knew you were going to get into the dental field?
Okay, so this is kind of bananas, but actually, yeah. Like when I was a kid, I was weird and my baby teeth just never actually naturally exfoliated, and so they actually had to get extracted by a pediatric dentist. And it was just a really positive experience for me. I thought it was a really admirable profession. And then this is kind of nerdy, but in like junior high, I took a career aptitude test and that's what it said. And so I was kind of like always really interested in it. And I do feel incredibly fortunate because oftentimes, when we are younger, like when we're in undergrad or high school, we don't know enough about ourselves and we don't know enough about the world to know what we should really go into. Oftentimes we're kind of prompted by society or people just make recommendations, but, honestly, rarely is that actually the correct choice. But I feel very fortunate because honestly, I like this is an incredible profession, you know? I love working with my hands. I didn't even realize it until I started working with them. I love dentistry because it really is this marriage between engineering and science. I mean, it's great. Like as dentistry progresses, we learn more and more about dental materials, and it really requires a very fine understanding for engineering. I went to an engineering undergrad, and so I feel like I'm really getting to apply some of those principles. Um, and so I think I feel very fortunate because I would say at about 6 months after I graduated dental school, I kind of had an aha moment. I was like, yeah,
Mhm.
I've got it pretty good. You know, I will say that did I have a couple of meltdowns in dental school, asking myself, did I make the right choice? Yes, you know, definitely sobbing in the shower. I'm not even gonna lie. And
Oh,
and that's common. That's common. Like I
yes.
think so often, but I do feel very fortunate, you know, like every day is not perfect, but I'm really grateful to be here, you know?
Thank you for sharing. I think that's such an interesting story, like you said. I mean, that's really cool that, since a young age, like you said, you kind of were like, oh, this is interesting and might want to get into that. And like, just kind of taking that experience and turning it into maybe like a career path that you're like, oh, this is really something that I want to drive home and do for the rest of my life is amazing. Like, and you keep wanting to build upon that. I just think it's such an interesting thing that you said, like some people you just know, like you get that instinct and you just go for it. And it's just so cool. Like you said, you started working with your hands. And I think, hey, this is the best profession for it, helping people feel good from the inside out using their smile. So that's
Yeah.
amazing.
Yeah, and you know what I will say? I will say that I am very fortunate to also get to practice in the Air Force because I do think
Hmm.
that no matter what you do, I think we all like a little bit of variety. And I do feel really
Yes.
fortunate, kind of like for I think like being an Air Force doc, you do get a bit more variety. You get a bit more experience into different things. You get more leadership experience. And so that adds just a like one more level of satisfaction. You know, like I love dentistry,
Yes.
but I do feel like perhaps like the leadership experience I've gotten through the Air Force has given me kind of the courage to start Dental Digest, you know, because it's scary to start
Exactly.
an
Yes.
education platform. But you know, I'll say that. I'll say I'm grateful for the variety like offered by the Air Force Dental Corps.
Yeah. And would you say also like there's like that flexibility and like thank you for serving, by the way, as well. And
Oh,
being a part of the Air Force and everything that you do helping with the dental community, because like, not only with the Air Force, but also like you said, your education piece and having that platform to really kind of give you that confidence as a leader. And I think that's awesome that you also want to help other people become leaders in this
oh,
community.
thank you. Yeah, thank
Yeah.
you. Thank you so much.
You're welcome. Would there be any advice for someone going into like wanting to get into dentistry? Would there be like a number one tip? Like when you said like you were nervous, like was there
Mhm.
anything when you kind of like gave yourself that leap of like encouragement? Would there be like a little tip or advice you could leave here for some of our listeners?
Yeah, just kind of trying to discern, is dentistry a good career for you?
Hmm.
You think, you know, I'm gonna be really honest. I feel like I'm too new to it. You know, maybe get back to me in a decade and then
Yeah.
I'll really have some good wisdom about it. But I do think this, okay, this is my philosophy on life. I think I can teach myself to learn to love just about anything. You know, like I feel like if I was a
Hmm.
garbage worker, what are they called? Sanitation
Oh,
engineers? I
garbage
don't know.
pickup. Yeah.
Garbage worker. I feel like I could somehow learn to be resilient and like that too. So I would say
Yes.
this is that there is like no perfect career. It really is what you make of it. And if you can
Yes.
learn to like teach yourself to enjoy it. And maybe like that's even why maybe there are definitely components to dentistry that I have had to kind of teach myself to like, you know? And
Yeah.
so in terms of like, is dentistry a good career for me? I will say this too. I know this sounds bad, but I think going into it, I had a bit of an expectation that it was going to be a bit cushier than it is.
Okay. Yeah.
You know what I'm saying? Like, so
Yes.
my
Everyone. Yeah.
husband,
Put that
yeah, like my
expectation.
husband is a resident physician, and um I felt like in dental school, I'm not gonna lie, I think that dental school is a little more 4 year demanding than med school. I know this sounds bad, but I will say I'm going on a tangent here, but I will say that my 4th year of dental school, I feel like I was slaving away and he was
Oh.
like playing Xbox, but that's just my
Oh.
perception. But
Yeah.
then I kind of assumed that, okay, well, once we graduate though, dentistry is gonna be very cushy, like no big deal, coffee breaks all the time. And, you know, being a physician, you're just like grinding away all the time. But honestly, I would not say that's the case. I think dentistry is pretty physically demanding. Like, you know, you get a lot
Yeah.
of backaches. So the moral of the story is, I know that was a bit of a tangent. But I would say this. I would say that I think a person can learn to love just about anything that they do. I think dentistry is very fulfilling. It's a great profession, um, but it's demanding. And I would tell a person to be prepared for that.
Yeah, know your expectations. Like you said, yeah, like make sure you know what you're gonna have to go into, right? Even though if you don't know, you're kind of like, okay, well, gotta kind of do a little bit of research here. And like you said, that cushiony feeling, I think everyone does that. And that's like some great advice. That really just like opened my eyes too. Because I feel like a lot of people, they go into a profession and they kind of like hold themselves back or they're not really sure and they get scared. And you just to say you like to put your all and to keep learning. I think like that was just like the most best little nugget you could give somebody, like you said, like to learn to love it, to learn to be better.
Yes.
Because not every day is perfect. You go into something and everything's got a shelf life, like you say, but you've got to choose to love it.
Mhm.
Even if like, you get into it and you weren't sure, like once you're in it, I mean, you've got to choose it every day because, you
Mhm.
can hopscotch everything, but at the end of the day, if it's making you happy and you originally got into it and it makes you happy, like you said, it makes the profession makes you feel happy. Like that's the greatest advice. I'm really like, my eyes are opened on that because you're right. I think you've got to choose to make it worth your while. You've got to choose to learn the best, to be the best at it.
Yeah, I
Oh,
completely
you couldn't
agree.
have
And
said that
honestly,
better.
I would say like another philosophy of mine is that if you're not having fun with something, that doesn't mean it's time to quit necessarily. It really
No.
doesn't. I think sometimes that
Mm-mm.
means to like dig in deep and strengthen your resolve and find things to like about it. I don't
Yes.
know. I think so often people when they're not having a good time, they think it's time
They
to
just
quit.
quit it. Mm-hmm. I couldn't agree more with you. Yeah, everyone's like, I'm done. It gets boring. I'm done. Like, no, you got to make it interesting again for yourself. You got to find those new challenges that make it worth it. So, really great piece of advice there. I'm really happy you shared that with our listeners today. So this is going to bring me right into dental tech chat and some questions about you and the technology you use like within your practice whenever you're doing. So number one would kind of just be a diamond in the rough. So this is a product that you're using in your practice that maybe not many other dentists are using. That's been a big advantage for you in your practice.
Okay, so this is going to be unconventional and probably not what you would think for an answer, but I would honestly say using rubber dam. I think that they have made an immense comeback. So, like,
Mm-hmm.
rubber dams are basically use them for isolation, and they've made a huge comeback, right? I feel like they initially came out into the market. Some people embraced them, many people didn't. They thought it was inconvenient. And
Mm-hmm.
then, almost, I would say, there would be a generation of dentists that really kind of try to avoid using a rubber dam. They would use cotton roll isolation. And then now rubber dams, it's almost made this resurgent. And it's almost like very sexy to kind of have this beautiful isolation, take these beautiful pictures. And I would say that's my diamond in the rough is people are overlooking it. And this is why I say this. And this is why I would say that in response to that this is related to dental technology is this really enables me to practice like advanced adhesive dentistry I mean, just like incredible and feel very confident in the restorations that I'm delivering and
Mm-hmm.
feeling very confident that this is a good service to my patient and that these are going to be restorations that are going to last a long time. And because, like, as we know, like a lot of the adhesive technology we have is hydrophobic and
Mm-hmm.
the saliva is going to contaminate the bond. And so, with these rubber dams, rubber dams. So, the other thing about like with rubber dams that I think a lot of dentists don't realize is that if you can really become good at them, I think you can do considerably like faster operative and restorative and indirect restorations because you have that good isolation, the tongue's out of the way, you've got good moisture control. So I've
Mm-hmm.
noticed it's like if I can just invest those first couple of minutes up front to get really good isolation using Teflon tape, not being afraid to use multiple clamps, and even a customized rubber dam, saves me a lot of time down the road.
Yeah, I think that was a really great tool. Like you said, yeah, like, everyone's definitely coming back. I've been seeing so many dentists be posting their different restorative procedures, even on in LinkedIn. You're seeing it all over social media again. Is there any like rubber dam specifics that you would say when it comes to ordering them? Would there be any like you kind of been using a lot lately in your practice that you could recommend for someone who's ordering those in?
Okay, so you're thinking like, is there a specific brand or specific
Yeah.
things to look for?
Mm-hmm.
Honestly, I'm not gonna lie. I don't know if I
Okay.
have like any sort of brands to look out for, but one thing I will say, just kind of a little hack, is don't be afraid to use multiple clamps. I use multiple rubber dam clamps. Traditionally in dental school, we're just taught to use one, but I'm telling you, you can get like really good rubber dam inversion if you're not afraid to use a couple.
Well, that is a really great little side note, like you said, a little tip, because yeah, I was about to say, probably people weren't thinking of using additional ones. And if they are, to get that secured correctly, like you're saying, good to know. Well, thanks for sharing that for number one on no risk, no reward. So this is going to bring me into no risk, no reward and closing out our diamond in the rough. So this is going to be something that you're going to be a big investment of time and money in your technology that definitely paid off in your practice.
I will say, okay, so I'm an Air Force dentist, so I don't necessarily have control over the supplies.
Mhm.
And we're not necessarily thinking so much about, like, we really are thinking a lot more about kind of what is the best service to the patient.
Right.
But one thing that I will say, if we're thinking along those same lines of what is like the best, really kind of best bang for your buck, best investment, I will say that I'm very grateful that the Air Force trained me in IV sedation. And that is something that me and a colleague use a lot. And I will say that that is immense bang for your buck. I feel like
Mhm.
the patient is a lot more comfortable. You can, um, like you can kind of work a lot faster. Everybody's kind of having a better experience if the patient's really comfortable. But also, kind of, if we want to talk about technology, like I will say that, yes, I will say that the CIRAC is absolutely like that's, I think, a great investment. I will say that if you really are kind of to look for the numbers, it does actually quickly begin to pay for itself. I don't have the
Mhm.
exact numbers of, you have to do X amount of indirect restorations, but um, I mean, it is really great. Like, I think that's kind of becoming the standard where patients do expect to have that
Yes.
same day restoration. And, while it's milling out, you can schedule appointments between patients. Like, I'm very fortunate that our clinic, we have a mill right in their same day. So,
That is
and that's
nice.
another thing that is very expensive up front, but at the same time, it does begin to pay for itself because you're not as worried about those lab fees.
Yeah, and sending all of that out can get expensive, coming with all the different paperwork and having to get so many patients, and are you sending them all out and getting all of it in? So yeah, I've been hearing a lot of good things about, having your own in milling. And I think a lot of dentists too, it's just, based off of too, how many patients you're having coming in to get that done. So like you said, it does kind of matter to that, but the ROI does really return most of the time when it comes to getting that, to having it in your practice for your patient.
Mhm.
And for our listeners, is there like any certain type of other technology right now that you've been using? Like when it comes to any of your panos and stuff, has that been really big too in the Air Force? Like, has that been helping you guys do a lot of implants or anything?
So, when we're talking about technology, does it have to be strictly digital technology or does it kind of like advances in dental materials?
Yeah, just either or. Yeah, we're just really like to share just any aspects of what you're using that you like to use into the practice. It can be either
Okay.
or. It
Yeah.
doesn't have to be just digital.
Yeah. Yeah. Um, okay. One thing that I will say is that adhesive dentistry has enabled so many advances in dentistry as a whole. Like, I think you can afford to be much more conservative. You can feel like
Yes.
you are giving a patient a restoration that's going to last considerably longer. And so I will say that the bonding systems that we have available, I feel very confident in. Sorry, I don't know if that answers your question.
No, it does. Thank you. Yeah, I just wanted to kind of hear like what else, like, that you were also saying like you've been using like within your practice. And if it's bonding, hey, that's great to know, because if it is advancing things, that's what we want to talk about. All the keeping technology on the edge. What's been helping advance your guys' dentistry? This question I'll have for you for your podcast. So is there any new upcoming episodes that you're really looking forward to, or different topics that you've been kind of learning and educating on that you'd like to share with our listeners, to tell us a little bit more about yourself and different things that you've been implementing to teach the dental community?
Yeah, yeah. So, thank you for asking. So, the podcast is largely related to comprehensive dentistry and really kind of
Yes.
getting the authors of different journal articles, textbooks, key opinion leaders, and professors to talk about where's dentistry moving, like what is really on the cutting edge of dentistry. And one
Mhm.
thing that I've kind of really gotten involved with through the Academy of Biomedic Dentistry is the scientific advisors for the Academy of Biomedic Dentistry. And so, um, there's one episode that's going to get launched pretty soon, and it's with Junji Tagami, who is,
Oh, that's
uh,
amazing.
yeah, like really at the forefront of Karari dentistry. And so I mean, this guy is like the pioneer and the creator of a lot of adhesive dental systems. Man, I feel like this episode today was brought to you by adhesive dentistry. You keep hearing that word a lot, but so that episode's going to launch soon, and it's pretty neat because yeah, I mean, he's like the lead scientist behind Clearfill SC, which is a very common bonding agent. It's a self-edge adhesive bonding that is really commonly used, and it's so interesting to get to ask the creator of it,
Yes.
hey, how did you make this? And just really getting to ask that person all these little nuanced questions that I've always been wondering, and it's also kind of interesting too because I have some episodes where there are some pretty big key opinion leaders that are shaping dentistry who
Yes.
still disagree with each other on matters, and that's good. I mean, that's really what science is all about, is we don't have all the answers and we're just trying to get a little bit closer. And it's kind of interesting because 2 weeks ago Domenico Riccucci's episode launched, and he's talking about pretty controversial topics in endodontics, and perhaps some of the things that he has discovered, the kind of like field of biomedic dentistry disagrees
Yes.
with a little bit. And they're both really incredible scientists and key opinion leaders, and it's interesting to get to see those differences in their opinions. And again, it just highlights really the beauty of science, where we don't have all the answers, but that's what makes dentistry so exciting, is it is a science.
Yeah, I couldn't agree more with you. How it is definitely, it's always so complex. It's always changing. It's always moving. We're always learning new things. So yeah, I'm really looking forward then to these episodes too, because I also am a listener and I love that you get to go over
Aw.
these topics and we get to learn from also your podcast. So I'm really looking forward to hearing more, like you said, about this different agent that he's going to be telling us all about that was created. So thank you for sharing a little tidbit on that. And before we close out, just to bring it all back to the dental tech here, just kind of wanted to say thank you for explaining the few things that you've been using and explaining the little tips and advice for our listeners. And just kind of wanted to ask before we go, if you had anywhere we could have our listeners come and find you. So if they had any questions and where they can come and reach out.
Yeah, that's super kind. So I kind of built like dentaldigestinstitute.com, which is this website where basically dentists can go and get dental and continuing education credit through the podcast. Kind of cool. But
Very
I'm
cool.
pretty active on Instagram. I never thought I would turn into such an Instagram junkie, but the Dental Digest podcast Instagram, like, I mean, you hit me up today. That's typically the fastest way to get a
Yes.
hold of me. Email, I try to be good with that, but Instagram, for whatever reason, just seems to be where dentists like to hang out and just network and like hang out with each other.
Couldn't agree more. We're all on there. You can all come say hello. Yeah. And I think that's just so really awesome that you have this platform now where you're able to reach out. And I just wanted to say like, congratulations on getting to like your top of the chart and winning the awards for
Aw.
some of you, your podcast has been taking off this past year and it's really not gone unrecognized. You've been putting a lot of hard work into your baby and it's so awesome to see how
Thanks.
it's grown. Yeah, you're welcome.
Aw, thank you so much.
You're so welcome. Well, thank you so much, Melissa, here for all of your dental tech advice for us today and kind of sharing with us a little bit more about your background and your podcast and your amazing work of dentistry. And I look forward to also bringing you back. And like you said, in a little while down the road and kind of hearing what more you've learned and what else we can talk about your growth in the dentistry. So thank you so much for being a part of our podcast today.
Awesome. Thank you so much, Al.
Thank you for supporting and listening to the Dental Tech Chat podcast. And of course, for our listeners, this is a YouTube episode, as all of our podcast episodes are available on YouTube as well. If you prefer to watch along, and go ahead and search for Sodium Dental on YouTube, and you will see all our Dental Tech Chat playlist. Please make sure you hit that subscribe and bell notification so you don't miss out on any new episodes posted to our YouTube page. Please make sure you do subscribe on our YouTube or any podcasting platforms. And thank you so much for being a part of our community here on Sodium Dental to learn all things about dental technology. And if you guys have any questions, always feel free to reach out to us via our email or number.